I'm Ashley McClary. I work at Pediatrics as a pediatrician, and we're affiliated with Mission Children's Hospital. I wanted to talk to you guys today about finding the right pediatrician for your child, teen, or new baby. I encourage you all to write questions through the comments, and I'll answer them as we go along. So one of the first things I recommend is talking to friends, to family, people who know you, who understand what you might want and need. Other sources could be your church group, parenting groups, your yoga class members, that kind of thing, and really finding out what they like about providers in the area, what maybe they don't like. Then you can also talk to your OB if you're a pregnant mom. That's another great resource. Additionally, I would recommend going onto your insurance provider's website or calling them to make sure that when you find a list of providers that they are covered by your insurance, because the last thing we would want is for you to come to the office and then be stuck with a bill if your insurance doesn't cover it. Other things, the AAP and the Academy for Family Practitioners also have a list of board-certified pediatricians and family practitioners, so you could always go on their websites too if you had some names or if you were looking for a certain location. It's harder if you're new to an area, maybe haven't made a ton of friends or connections yet, and again, that's when the internet's going to be a good source, the yellow pages, or calling your local hospital and asking who they work with and recommend. Okay, so you have your list. What's the next step? I recommend calling the practices and setting up a meet and greet. A lot of practices will do that for you, and if they don't have a meet and greet, some other ones will have group classes, say for newborn mothers. It gives you an opportunity to be introduced to the practice as well as the providers. Once you've scheduled your meet and greet, really sit down and think about what's most important to you. I'm going to want you to write down a list of the questions that you're going to be asking the provider, so it's important that you spend time thinking about this. Some common questions that people go through are things like, who do I call if the office is closed? Are there other providers that work in the practice? Because if your pediatrician or your family practice doc or the nurse practitioner is on vacation, who are you going to see? And that's really important too. Other things might be, where do I go to get lab work done or imaging done if the doctor feels like that's necessary? Once you've kind of compiled this list, also delve in deep and find out what's important to you. Do you want a physician who feels really strongly about lactation and can talk to you and help you through those kind of things? Preventative measures like nutrition and exercise, vaccinations. That way you'll be prepared when you go and you meet your provider for the first time. Okay, now you have your list, you've picked your names, you're going to meet potentially this provider who's going to help you and your family the next 18 years, or if it's a child or a teenager. When you're in the waiting room, talk to the other parents that are there. It's really important to get their opinions. Who are they seeing? What do they like about the provider that they see? What are some other providers that they may have seen that they didn't like so much? Additionally, you can get a feel for the waiting room. Is it child-friendly? Is there a separate waiting room for sick versus well? Is it teen-friendly? And I definitely recommend bringing your teen with you if you're picking out a provider for your teenager, because their opinion is going to be huge. Is the staff, the front desk staff, friendly, welcoming? Are they able to answer your questions? All of that is really important because you have to remember every time that you're going to these practices, it's going to be that experience. The nurse taking you back, the same thing. And then when you're in the room with the doctor, how is the room set up? Does it seem, again, child-friendly, teen-friendly? What's the impression that you get? Okay, the doctor walks in the room, how's it going to be? Do they greet you? Do they look you in the eye? Do they introduce themselves? Do you feel that you're being heard? Do you feel that they're fully answering your questions? Do you have time to answer questions at the end of that visit? So all of that's really important, and each patient-provider interaction is going to be really unique, and listening to that voice is going to be important for you and your family too. Once you've chosen your doctor, that's awesome. Let the journey begin. So that's some general points, and please write down comments and I'll address some other questions that you guys have in just a bit. The other thing I wanted to talk to you all about is once you've picked a provider and you're going for a visit, whether it's a well child visit or a sick visit, how are you making the most of that visit? And I just want to give you some tips because it's helpful for you, for your child. Maybe you're going with another family member. These are going to be pretty general tips that will help you in any of those situations. So first off, you really want to frame the visit. What are you trying to get out of the visit? Is it that your child's medication isn't working and you want a different medication? Is it that you want to know whether or not this symptom is harmful or not, or might mean something dangerous to your child and you want that reassurance? Helping to frame the visit before you go will also help you create a list of questions, and that's going to be one of my big tips for you guys. Okay, so once you've framed the visit, I have 6 tips. 1, make sure that you bring any medications that your child is taking. Make sure you write down the name, the dose, and the dose is not only the volume, but hopefully the concentration as well, meaning sometimes a medication might say to take 5 mLs or a teaspoon, and that's helpful for a lot of medications, but some have various concentrations, and so it's important to write that down too, so your provider will know exactly the dosage that your child is getting. If you're not sure what I mean by that or where to find it, bring the medicine in, and the MA, the nurse, and the doctor can go through that with you. Number 2, bring a list of your questions. This is really important. Even if you think that you are going to remember everything, no one ever does. It's so hard. You have your kid running around or crying, the doctor is saying things, and you're trying to think of that list of questions. So writing it down is really key, and I can't express that enough. It'll really ensure that your visit is complete, and that you feel like all of your questions were heard and answered thoroughly. The third thing, in addition to the list of medications, your doctor or provider may need previous information if there was a prior workup done. For example, your child has a headache and had already seen another doctor and they did some lab tests or imaging. Make sure that the practice has that information. It's becoming easier these days with electronic medical records, but sometimes a hospital may not have the same electronic medical record as the practice. So a few days before your visit, give the practice a call and make sure they have everything. It may mean just going by and signing off on a paper release of information that the practice can then follow up with and get everything that they need. This will ensure a more efficient visit. What am I on? 3 or 4? The other thing is to make sure that you write down what the doctor or provider says, or you bring an advocate with you to help remember. Again, visits can sometimes seem rushed or hurried, or a lot of information that was thrown out. If you feel like you're not quite understanding everything, ask the physician or provider to write it down for you as well, particularly if there are multiple steps that need to happen next. That's another good tip. Okay, and my final tip for you guys is clarify, clarify, clarify. I can't stress this enough. As providers, as a pediatrician, I want my families to understand what the conversation was talking about, and what the next steps are going to be, and you know, what other things to look for that would be maybe more concerning. And the best way to do that is to make sure that everyone in the room has a shared understanding of those next steps and those things. So if there's anything that you feel fuzzy on, never feel that you can't ask for clarification or that you're taking up too much of time, because this is your child's health. We want to make sure that you are getting all the information that you need. Okay, so that was kind of a general overview. I know we had some questions pop up. Let's see. One of them, if you receive feedback that you don't feel comfortable with, how should a parent approach the subject or get a second opinion without causing offense? This is a good one. I know it can seem awkward sometimes when you feel like you want a second opinion, you don't want to offend your provider. And I want to stress, first of all, if you don't feel comfortable with the feedback, make sure that everyone is with that shared understanding, and ask for the clarification. Why do you feel like this is the right diagnosis or the right next step to take? What are some other things you're considering? Because a lot of times, your provider is probably thinking of other scenarios, but matching what's fitting the best with your child at that time. And so expanding on that may help bring to light some other questions or ideas that you may be having in your head that actually are matching up with your provider. Now, after that clarification, if you still feel like you want a second opinion, ask for it. Say, I just feel like there may be something more that we haven't discussed, or is there someone else that you recommend in the community that I could reach out to for a second opinion? That's great. And it's actually even better when your primary care doctor collaborates with that second opinion doctor, because more brains on the same problem are better than one. And I think most of your providers are going to feel that same way. So definitely don't be embarrassed to ask. So Ginny asks, if my child is sick, how can I get an appointment right away? Urgent care? That's a great question. I always recommend, if it's during the regular business hours and your child's pediatrician or family practice doc office is open, call them first. A lot of times they'll be able to squeeze you in for a sick visit, and it's really so much more rich when you're seeing a provider who knows you and your family and the history of the child. Now, that being said, if it's after hours or you've called and there's really no space, there are urgent cares available, and they're great for those kind of in-between illnesses where they're definitely not well, they're definitely not so sick that they need to go to the emergency room, but they do need to be seen by a provider. Maybe it's after hours, like I said, or if they can't get in to your provider. Urgent cares are definitely an option, and if it's more serious, the emergency room is available too. I hope that answered your question. Aaron asks, are all pediatricians certified by American Board of Pediatrics? Awesome question. No. And that's going to be important to differentiate as well. And when you go to your meet and greet, you can ask that. And it'll be important to get clarification on that too. This also brings up another important point. There are pediatricians who specialize in children's health. They've gone to medical school, and they've gone to at least 3 years of training after medical school focused on children. There's also family practitioners who are trained to take care of from children to adults and geriatrics. But some family practitioners will prefer working with certain ages. So when you meet that provider, just ask what they prefer to see. For the American Board of Pediatrics, you can go online, ADP, I think it's .org or .com, you can Google it, and you should be able to search for the provider in question and find out if they're board certified. Okay, should you trust online reviews? That's a good one too. I love online reviews, right? You use them for Amazon, you use them for your haircut, they're going to be super helpful. I don't know about you all, when I try to find them for providers, I feel like they're missing a lot of information, and sometimes the information is incorrect. We even had one of my colleagues who was documented as a neurologist, and she's not a neurologist. So can be helpful in sort of your overall repertoire of information that you're collecting, but I would just be wary of solely using that as your main source. And knowing that it may not be thorough or correct in some situations. All right, here's another one. When should I see a specialist versus a pediatrician? And how do I get access to a specialist? So that's an awesome question too. Particularly as the times are changing in our medical society as a whole. I think it's really important, and this is why it's good to pick a pediatrician or a family practitioner or a nurse practitioner that knows you and your family well. I think it's best to have that discussion with these providers who, again, know your family, know your child, maybe have even been involved in some of the conversations about the symptoms that you want to see the specialist for. And just like the second opinion one, if you feel like you're getting to the point where, you know, there must be something more, and we're not quite getting there, ask your provider, is there someone else I could see? Is there a specialist that I should see for this particular issue? And most of the time they should be very open and very willing to refer you to a provider that they trust, and also would be in network for your insurance as well. And I think we're all out of questions for right now. I really appreciate everyone for tuning in. Again, I'm Ashley McClary. I'm at McDowell Pediatrics, affiliated with Mission Children's Hospital. And I definitely encourage you all to continue to put your comments in on the Facebook feed, and we'll continue to get back to them.